what are the models, I suppose, for getting that training embedded? If, like you say, you can go through 9 years without hearing this, that and the other. One of the things that they've done in NHS London, which I think is really good, is practice nurses were very keen to learn more about mental health. And so what they did, a group of mental health nurse specialists from a number of trusts got together and put on, I think it's a 2-day programme. But they put hundreds of practice nurses through this programme, and it was evaluated really well. And I was wondering whether there's scope to do something like that with dementia care, really.
My challenge is around training and how we implement training and whether it actually changes what people do and how they live their values in their practice. Because in my experience, it doesn't, unless you do all the other things as well. Unless you're working, when you're doing the mentoring, you're working alongside with people. The pilot usually works really well, and that's because we are working together, we're looking very critically and reflectively, we're challenging what we're doing, and we're working in that support. We then make a one-size-fits-all, and we roll it out, or we spread. And those people that come on the training don't have that same experience. And it's just bits of paper, and we get lots of, maybe the paperwork changes, but we still keep doing the same old stuff. We're just going to do something very different at United Response with support staff, which is actually about using a creative process to help people be inclusional, responsive, be in the moment with people, but confident enough to do different things.
I just wanted to sort of pick up on a couple of your points. So it's just about kind of whether education achieves culture change, and I totally agree with you that if you focus education in a certain way for a finite period, or you throw resources at it for a year or 2 years, you will achieve a modicum of compliance, but not culture change. I don't think we've talked about Aboriginal nurses enough, actually. You will know there's not enough of them. I think some commissioning groups, NHS organisations, have really engaged with the idea of Aboriginal nurses, and some are still completely resistive to it. And therefore, at the moment, it's a lottery as to whether you will have an Aboriginal nurse or not, and everybody should have an Aboriginal nurse, or should have the opportunity to access an Aboriginal nurse, or a dementia specialist nurse. We talked about this before. There's a lot of evidence, I think, that would support having more dementia specialist nurses in the community, linked to GP practices, linked to Dementia UK Aboriginal nurses, and for some reason that is not happening. And I think until that happens, these holes will still...
The thing I keep getting heard is cost. That's what always comes to me, is the cost. Because they hear the dementia nurse specialist and they think, expensive.
And I think that's a real myth, isn't it?
Yeah, it is a real myth.
Empowering the carer and empowering the person with dementia, I think, is crucial, because we're always going to come across crappy services, crappy practitioners, and it's about letting carers know exactly what their rights are, that they have a right to ask questions, they know that they should be entitled to a service delivery. They're entitled to dignity and respect. It's so important.